Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, friends. Welcome back to the BariNation podcast. Today, Jason and I have the pleasure of introducing you to somebody that we have never been able to interview on this show. Heidi B is joining us today. Hi, Heidi.
Hey.
The reason I didn't say her last name is my mouth has a hard time forming the words to pronounce her last name, so I'm going to let her do that herself. But Heidi is the past president of the integrated health arm of the ASMBS. Her leadership has really put the IH section of that society front and center. She's been a practitioner for a very long time. She is passionate about patient care, both before and after surgery. And the reason that this conversation is so important for you, the listener or the friend watching, is because no matter where you are in your bariatric journey, it is really important that we look beyond the surgeon and understand the team behind that person who is supporting the patients, right? The surgeon has a very important role to play, but equally important is the team of professionals and credentialed experts that are supporting you day in and day out throughout your journey. So Heidi is really going to explain to us the importance of looking for and picking your dream team when it comes to your bariatric life. So again, no matter where you are on this journey, it matters because as we all know, post-op people need just as much support as pre-op people. So before we dive into that conversation, Heidi, will you introduce yourself to our friends?
Yeah, I'm Heidi, and it's Bednarchuk, so not an easy name at all. I have been in the field for 13 years. I kind of came into it happenstance. It wasn't what I was planning on doing. I just took a while to figure out what to do with my life. So I have a bachelor's in classics and anthropology with an art history minor. I was going to be an archaeologist. And so with a degree like that, then you naturally spend 15 years as a casino pit boss while you try to figure out what to actually do. Joined a local ambulance crew while I was doing the pit boss thing, just to do something good with my life, and really loved healthcare. So I went back to school for nursing, and then went to get my graduate degree. And I did my clinicals in palliative care, and that's what I was intending to pursue. But at the time that I graduated, a position opened up for a brand new bariatric program. They needed a coordinator to get it off the ground in my hometown, which I wanted to move back to. And I guess I can learn about this. I'd watched my mother struggle with obesity her entire life. And absolutely know that now that I ended up in the exact right place and, great connections between palliative and bariatrics, actually, where the focus really is on quality of life and maximizing health. So, it was a natural fit. So, yeah.
Oh, I think we love you even more now to know. We did not know you were an actual pit boss. That's wild. And that's awesome.
Yeah. Very strange history. So.
I don't think it's strange. I think it's rad.
I think it's awesome. That's your party trick that you can pull out and be like that. You would totally rule two truths and a lie. Like nobody would ever get that.
No, ever. But I would assume, I've been to a casino a few times and I haven't had any negative interactions with pit bosses, but man, those people pay attention to absolutely everything. They know what everybody's doing at every table, and you are running a tight-knit team. So I would imagine the skills that you picked up there have translated beautifully to your current position in bariatrics.
Absolutely.
Oh my gosh. All right. Well, let's dive into this conversation now that we know you are absolutely the one to talk to about this. When you and I reconnected at this year's ASMBS, I knew very quickly that you would be a strong voice on this show because our listenership has shifted a little bit. We've had the opportunity to interview many experts like yourself, and we are seeing clinicians and surgeons that are also listening and watching to the show. And the importance of a care team I think even for myself and probably for Jason, is very much overlooked because the focus is so pinpointed on the surgeon and those surgical outcomes. But you have spent your career, and we have so many resources that we're going to pass on to you that really highlight this maybe miss when it comes to bariatric care, and the important emphasis that we all need to place on that team. So in this high level view, Heidi, why is it important to really look at the team that's supporting the surgeon, and what are the different roles on the team?
Yeah, I think the team is absolutely vital. You've talked about in the past, shopping for your surgeon like you shop for a pair of Levi's, right? But, the surgeon does the procedure, and obviously very, very important part. So nothing against my surgeon colleagues at all. But who's preparing you? Who's supporting you after? In some cases it's a surgeon, but most often it is that interdisciplinary team. They are there for you through the entire journey, which is not just a day in the OR, right? And we know that, surgery is great, but it has, those healthy lifestyle patterns, are so important for that long-term success too. And we know it's progressive disease. So the team, the interdisciplinary team, they're the ones that are there for you afterwards too, to help with any struggles or challenges. And yeah.
And that's one of the biggest things we notice too when talking to people. And if they have any type of question or anything post-op, they get real nervous because, well, I don't want to bother my surgeon. He's so busy. But it's good that you bring it up this way because it really is. And a lot of times you're talking to that team, and that team's been put together for that specific reason to handle all of those things. So it's not that you have to, because we try to tell people all the time, like, reach out, make that call, ask your care team, because it's important that they know kind of what's going on with you, just as important as it is for you to get the answers that you're looking for. So it's good that you explain it in the way that you did and break it down that way so that people kind of take a little bit of the scary veil off of, what if I make that phone call? I don't want the surgeon to have to get it's almost like they feel like the surgeon's going to have to drop the scalpel, come outside and be like, yeah, what can I do for you? Like, oh, I had a little gas pain. Like, it's not that way. Like, you can call and talk to the team. The team's got you covered. Like, it's not as scary as you think.
Absolutely. Right? Yeah, I always tell my patients, we are here. There's no dumb questions. You are never bothering us. Reach out to us. We have the patient portal where they can send a message. We give them direct phone numbers so they can get a hold of us anytime. Wow.
I'm so glad you said that, Jason, because it's so true, right? You're like nervous to call because you don't want to interrupt people or you don't want to be a bother, but it kind of creates this. It continues the shame cycle and the cycle of isolation. So Heidi, maybe you can just bust this myth right once and for all, right? Should patients be scared of calling? I'm sure the answer is no.
100% no. No, they should call. And especially if they feel like they're struggling. I have patients that say that they're afraid to come in when they're struggling with that. And I'm like, I tell them right up front, that's when I most want to see you, is when you're struggling. I most want to hear from you, so you are never a bother. Because that's why we're here. That's why having a strong team supporting that surgeon, supporting those patients is so important. Not all programs have that, so it's an important thing to look for. Yeah,
it is. In all the conversations that we've had, really these past few weeks, there is a sense of frustration on the patient end and on the provider end, right? Because some insurance companies so limit who you can go see and who you can get care from. So I think we need to acknowledge kind of that elephant in the room, that you might only have one choice when it comes to your bariatric options. Yeah. But as a patient, you can ask questions and figure out what their team, who's on their team, right? What's the team roster, so to speak. And if you feel that it's missing something that you think you're going to need, a follow-up question that you can ask is, okay, so I understand you don't offer this, this, and this. Where can I go to onboard this support if and when I need it? And I think patients forget you can ask that question of the center or the team that you're thinking about getting care from.
Absolutely. I think, as a patient, advocating for yourself and what you need, not just your needs right in the moment, but what you see as you're going to need long term, is so important. And I think a lot of people are afraid to ask those questions because they feel like the doctor is going to tell me what I need and I need to listen to them. And if they didn't tell me I need it, then I must not need it, and it's like, no, that's not true. You advocate for yourself, ask those.
Yep. Advocate for yourself. And a no shame plug, BariNation exists to be that bridge for some people sometimes, right? What we offer in our community is 100% education. This is not medical. This is not your care team. This is education. But if your center is missing some pieces that you think that you need, BariNation can be that bridge that gets you the support and the education that you need until you can find that one-on-one professional or a team that has all of that support. So just know that there are resources out there that can round out the team, even if the place that you've made the decision to go is missing some of those pieces.
Well, there's also, a lot of people we've found that they, don't know the questions to ask, or when they do get the questions to ask, they feel like they have too many. Like we've had people say, I filled up almost a whole notebook of stuff to ask, but I was afraid to get through because I thought it was too long. And I'm like, a lot of those times you can have multiple appointments. Like you can have your initial consult, but you can make multiple pre-op appointments to talk through those questions to make sure that you get the answers that you need. And a lot of times, a lot of those questions can probably be condensed into just a couple that you can ask and get the overarching kind of theme of what exactly is going to happen. And then you also have post-op to have those conversations too. But the thing that we try to, explain to people is like, there's no system that's going to be like, well, that's a dumb question. Next, like, what else you got? Like, no, it's not in the way that, we all have these, these fears, whether they be rational or not quite as rational, but it pays to do the research to ask the questions because you can never be too prepared.
Absolutely.
Yep. And again, Jason, great point. Like how many times on this show do we ask a question and our guest ends up answering 3 of the other ones that we wanted, right? So just by asking that 1 or 2 right questions, you might actually get the answers to everything that you wanted in a way that makes more sense to you. So Heidi, when we're talking about a team, right? Who or what are the roles on that team that you hope everybody has access to? Like what are they called and what role do they play on that team?
Yeah, that's a great question. So, obviously the surgeon, definitely a key player in the team, but, I think having good nursing staff, so they're often your first point of contact in many programs. They're the ones providing that direct patient education before and after surgery. The person picking up the phone on the other end of the line when you're calling with trouble. So, really good, dedicated nurse. Putting a plug in, ideally like a certified bariatric nurse, if they have that, right? You've got your APPs like myself, who we're often the ones doing that longitudinal care. I always tell patients, you're going to be seeing me a lot after surgery and you're stuck with me for life. Then our dietitians are a key player long-term and helping with just all of those challenges with our eating behaviors, food choices, working out. I would say always helping with opportunities for improvement or managing any kind of challenges or struggles there. The behavioral health providers, just because, there is so much that goes along with surgery and in our relationships with food and just, things change after surgeries. A lot of mostly in good ways, but there's also things that can be incredible challenges that people aren't always prepared for. So having that good behavioral health team and then, our exercise specialists as well are also a key player in the team. We're fortunate to work with some really great physical therapists where I'm at. So those are kind of the key. And then really looking for a team that has those integrated together, because I've heard a friend of mine, Dr. Lillian Krigstino, in a meeting we were in, was talking about the importance of team. And she talked about like some teams being a fruit basket where you have the individual fruits sitting next to each other. They're completely separate things and there's really no interaction other than they're in the same thing, right? And then you have the teams that are, those are very siloed teams. You have your multidisciplinary teams, which that's a lot better. That's your fruit salad. They're cut up into pieces. They're kind of jostling together. There's some connection and interaction, but it's still not completely cohesive, And then you have your interdisciplinary team, which you put them all in the blender and you've got a fruit smoothie, and the parts just become completely blended together, and you're getting consistent messages from everybody on your team, and we're all working in the same direction and to support the patient. And it's not just like this person gives their advice and this person gives their advice, but there's a lot of crosstalk between there. One of my favorite things is when I have a patient and they're struggling with one thing or another, we're talking through it and I throw something out and they'll say, "Oh, that's exactly what Grace said to me," which is one of my rock star dietitians. And I'm like, okay, yep, that's, to me, that's a sign of a really good team where we're all echoing each other. And yeah.
That's the best analogy that I've ever heard when it came to that, because I came from so I've had my original surgery and then I've had revision. So 2 separate teams, 2 separate places. I flew out of state to get my revision done because there's just nobody here that could compete with what I flew to. So mine was more like a poorly put together charcuterie board where nobody talked about anything to anybody. And then I went to the smoothie. So I'm gonna rock with the smoothie every time because it's so much better. Like it just, like, everything about the cohesion of it all and everybody talking, it just made it felt like I was doing everything except my own surgery with the first one. And the second one, I didn't have to do anything but fly there. I was just like, oh, this is great. Like, I like this so much better. Like, because I thought I was afraid they were going to hand me tools and be like, we're not going to put you all the way under because you're going to have to do some cutting while you're in here. So.
Dude, that is, and Jason knows when you were talking about that analogy metaphor, I don't know. I was not an English teacher, but I played one for a brief, like that. And now the visual in my brain, I'm like, oh my God, it's a graphic. It's like, oh, but this is what matters to patients, right? Because we finally understand the difference and the importance. And Jason, I know, right? Your first and second experience was vastly different. And I just know that Nat and I and members of our community saw the difference in you as a person based on the recovery that you got during your revision versus your first. And granted, you don't know what you don't know when you go into your first one, right? So this is just what you knew. But now to have that to compare to your first one, it makes all the difference in the world.
Oh, absolutely. Yeah. Without knowing the difference between the manual surgery that I underwent and the robotic revision was just, plus the aftercare was just night and day. I didn't leave without having an IV of fluids in the banana bag, so to speak, with all of the vitamins and all the things. And so I legit felt like I could fly home without the plane. And, it just was amazing in the difference where I felt like I lumbered. I should have stayed in the hospital another 3 or 4 days with my first, procedure. And the second procedure, I'm flying home 3 days later and feeling, no discomfort whatsoever. So it really, but honestly, yeah, like April said, you don't know what you don't know. I was just looking for a lifeline at any point when I had my original procedure. So I didn't like as far as a lot of the kind of research I did beforehand, I wasn't even really that deep on. I was like, can you save my life? Cool, let's do that. And then, at that point, you just get what you get and that's fine. But having the ability to see the other side of how it can work is just what, BariNation has afforded us the gift of being able to see kind of behind the curtain that a lot of people don't get that option. So that's why we wanted to create this on a bigger scale so many people could actually see what we're talking about before they have their procedure so that they know. And when we talk to people who have not only done the research, but also gone off of the things that we have said, the people that we have talked to hear them have such positive first-time experiences has really made it worth everything for April and myself, who didn't have the best, original situation. It's just awesome to see so many people taking that and realizing that they can be better.
1,000%, 1,000%. And, the other thing that I think it's important that we call out, right? We have all these conversations and we're talking about here's, if we were to do it over again, here's what we do. And here's the questions that we ask. And right. And our mission is to connect you with the information that we wish we had right before we had gone into it. But we have to be very clear about this. You finding and choosing an integrated team, like what Heidi is talking about, does not mean that you are giving up your responsibility of continuing to follow up with that care, right? So just because you have the rockstar care team does not mean that they are going to do the work for you. You also have to take ownership in your very important role with this. And that is, you have to make the phone calls. You have to book the appointments. You need to do your homework and your due diligence. You need to show up with a growth mindset of, I don't know what I don't know, and I need to learn from the experts. And you have to do then the things that they have asked you to implement with fidelity, right? Because it's one thing to learn it. It's a very different thing to actually do it and practice it. And if you're not holding up your end of the bargain, you can't expect the care team to carry the weight that you are not doing when it comes to care. So know that when we're having these conversations, we have to acknowledge that we have to do the work as our care teams are doing the work. And as Jason and I know, that's hard as patients. You're battling a disease, you're recovering, your life is changing in ways that you never expected. There's a lot of grief. There's a lot of things that come with your post-op life. So just because you have that care team doesn't mean you just get to throw your hands up and be like, okay, I've done it. I found the team. No, now you actually have to play on the team with the people who you have selected.
100%. Yeah. You've got to put in, it's a collaborative effort and the patient is part of that, right?
Yeah.
I think back to the conversation you had with Kara Horn, and she talked about her lawn analogy, which I absolutely loved. And, if you're not taking care of that lawn afterwards, it might look great initially when it's put in, but if you're not using those tools and doing the maintenance work on it, you're not going to have those results that you're hoping for, and nobody else is coming in and doing it for you. Now, your integrated health team, we're there to help keep those tools sharp and in working condition, but we're not going out to the lawn and doing it ourselves for you.
Yes. Oh my God.
Yeah.
When two analogies come together, two metaphors, I have like goosebumps. This is like my teacher heaven right here. I love it. Hey friends, it's April. Dr. Majid is joining me today to talk about the upcoming fall walks happening for the TRIO Foundation. Dr. Majid, where are these walks happening and why are they so important?
Hi, thank you, April, for having me, and thank you for all the support BariNation has provided. Really grateful. Guys, BariNation is the place to be. If you are thinking about bariatric surgery, if you've had bariatric surgery, you've seen enough to know that this is like the place to be. So thank you, April, for all the work you're doing. And thank you to BariNation. I am super excited to introduce The Walk to all of you. So it was rebranded this year from the Walk from Obesity to The Walk. And we really are encouraging every single person out there, whether you get affected by obesity directly or not, to come and walk to support this very important mission. Obesity is rampant. If you look around yourself, you'll see plenty people are affected by this disease. And every dollar that you contribute goes towards not just critical research so we can treat, educate, and end obesity, but also to provide access to care, to be the advocate for that patient, for that person who's suffering with this disease silently and feels uncomfortable or not brave enough to step up and advocate for themselves. That is where the TRIO Foundation comes in. And the walk of the foundation is an excellent opportunity for you guys to come out, get your heart rate up, get some steps in, benefit from it physically and mentally yourself, plus contribute towards this amazing cause. For just $30 online registration, you can achieve so much. There are fall walks happening between September through November for this year, at least 10, if not more, throughout the country. It might just be happening minutes away from where you live. So participate, and gain the benefit from it in so many ways. I cannot wait to see you there.
We hope you stomp the stigma with us in person this fall. You can click the link in our show notes to see if a walk is happening near you. All right, friends, let's get back to the episode. So Heidi, if you're pre-op or you're post-op, whatever, you're ready to look for a team. What are the questions that patients should be asking to try to find this integrated team that you're talking about? Like, how do we know that we've got that? We have the smoothie, not necessarily the fruit salad or the charcuterie board.
Right. If you're at like an information session, one, does the surgeon, if it's the surgeon giving it, which it common is, do they even mention the integrated team? Do they mention who else is involved in the long-term care of the patients? And if they don't ask who is on your team, what roles do they play? How does interdisciplinary teamwork look like? What does it look like where you're at? I think those are good things to ask. Also exploring like the website, seeing, does it show just the surgeon or does it show other team members or talk about them? If there's patient stories, do the patients just mention the surgeon or do they talk about the team? I don't know. Those are some kind of things you can look at. With our team, I think an important thing to ask is, does your team meet together? How do they make decisions together? How do they support patients? Because we have interdisciplinary team meetings where we have all the disciplines together and we talk together. If there are patients that are preparing for surgery that are struggling or post-op, we as a team talk about how we can support them from each of our own angles and, together. So, kind of asking those kind of questions about what does the team look like and how do they function at your facility?
And I really like that question about how does the team communicate with one another, right? That's a very poignant question that kind of gets to the heart of a lot of different things, right?
Yeah.
Because if the team's not talking, then why? Why are they not talking? What's the purpose of not having them communicate? And that would lead to kind of that siloed feeling that maybe, right, that team or how that team has been organized. So that's a great question for a patient to ask that really gets to the heart of what we're looking for.
Yeah. And then also asking what does postoperative care long-term look like with your program? Who's there? Who are you seeing? How often are you seeing? Because if they say you're just coming in to see the surgeon, or the APP, that's probably not fully delivering what you need postoperatively.
Yeah, no, that's good. So the first time we'd actually heard that, like the fully integrated health team situation, is when Natalie and I visited Advent Health in Orlando. They talked about that from a standpoint of every single person, every appointment you would have pre-op. So it doesn't matter if it's an endocrinologist, it doesn't matter everybody on the team comes together. So everybody, as soon as you have a test done, as soon as you have a lab done, as soon as you have anything done, it's automatically transferred to the program. So you don't have to go, like I had to go, when I had my first procedure, I went to, all these different appointments for all this different stuff, and nobody had any of the information. So it was a whole thing where they had to request the records. Everything had to come up. So there was this big long wait period in between all these steps. Whereas within the fully integrated health team, it wasn't that way because everybody spoke about every single thing back and forth. So every appointment you went to, everything came back to to the surgeon's office so that they had all of that information right there. And it all got, it was all basically uploaded at the same time. So nobody waited on anything. And that to me was such a stark difference in what I had experienced. It was just, it made all the sense in the world to me, and everything kind of came full circle. I was like, this is the huge difference between having a team like that and having something where it's sectioned out, where you have to go all over town. Whereas if it's an integrated, a lot of times you can get it all knocked out in one building and just be fine and not have to do a bunch of running around. So it's an amazing difference.
Yeah. Yeah. That's a really important point about everybody being able to see what everybody else is doing too. Cause I oftentimes, if I'm preparing for a visit and, somebody from my team that just has sent a message about, they're struggling with this, I'll go into the chart and I'll look like who have they seen, else have they seen, what are the notes saying? And so that we can, make sure we're all coming together and addressing what needs to be addressed.
Yeah. Well, and now that you said that, Jason, I think back to my pre-op experience. My center was great. I felt really confident about what I went through in my pre-op journey. And that was my experience, right? There was all these tests that I had to get done. There were so many appointments, right? It felt like a lot, but it was the receptionist who booked all of my appointments at one time, right? Made sure that everything aligned, made sure that, oh, no, you need this before you can have this follow up because this person's going to want to talk to you about this, right? And really gave me a roadmap. And every time that I checked something off that roadmap, it was the receptionist who reached out and was like, great, you got that done. Fantastic. This person is going to be really happy, that you've got this done. Then you're going to meet with them. So it was that integrated system that I didn't have the words for at the time, but it certainly took the pressure and the fear and the anxiety down a little bit because I knew that this team was capable of walking me through that. And, as all three of us know, there is a lot of anxiety that goes into that pre-op process. There's a lot of excitement and joy, but there's a lot of worry. It's just this washing machine of emotion. Mm-hmm. And to have that integrated team kind of slows down that motion a little bit for you. It's not going to take it away, but it is certainly going to help you feel better moving forward with this very big decision that you're making in your life.
Yeah, absolutely. And it's a good point. That's one key role I forgot to mention. You mentioned the receptionist. We have in our program a person we call our navigator. And they're kind of helping, get everything set up and guiding them through. Because we've had patients that, I've seen to establish care that had surgery elsewhere and said they felt like, it was up to them to go out and get their appointments. And then once they finish their appointments, circle back with their team and say, okay, I think I'm ready. Can we have surgery? Mm-hmm. And that's just not a great way to do things.
No, it puts more barriers in the way of a patient. And there are already plenty of barriers to access obesity care and treatment. Absolutely. So if you're working with an integrated team, the reason that they're doing it that way is that they want to eliminate some of those barriers that you could be experiencing so that they can move you through the pre-op and the post-op process as efficiently as possible. Mm-hmm. And I know, Heidi, before this conversation, you really took a deep dive on the questions that we wanted to ask you. And I mean, literally, guys, if you guys could see these show notes, my notes were one page. Heidi set back like 5 pages. And I was like, oh my God, right? But one of the things that really stood out to me that you found was referencing some studies that asked patients what was kind of most important to them after post-op. And it really focused on that post-op care. It was nutrition, it was mental health support, it was movement support. Yet so many of the current programs in America are focused on the surgical expertise, right? Which is important, but what patients actually care about are these things.
Yeah.
Why do you think there's such a disconnect?
I think, a lot of our accreditation programs and insurance programs and things like that will measure the surgeons and evaluate programs based on outcomes. And they look at outcomes in terms of weight, in terms of complications, in terms of comorbidities, and now that's great because obviously a lot of people are doing this because they want to manage their obesity, bring their weight down, have those health improvements, but it really misses that what matters to the patients and that quality of life measures, those non-scale victories. What can you do now that you couldn't do before? And one really interesting study that I saw, they had patients and healthcare providers prioritize post-surgical outcomes. And when they got to quality of life, there was 7 outcomes that patients prioritized, and only 1 that surgeons prioritized out of the quality of life outcomes. Now, if you looked at the other members of the integrated team, dietitians prioritized, I think it was like 4, and behavioral health providers 6, and nurses had like even more than patients prioritized in terms of quality of life measures. And so it's just, the different approach and what we're looking at. And, surgeons naturally are looking at what they're measured on, but that's not necessarily what is important to the patients. And I think that's where, too, the integrated health team is really key because we're helping focus on those other more patient-centered priorities,
Mm-hmm. When I read studies like that and we have these conversations, the place that my brain always goes is what Jason and I often talk about on this show, right? You're the consumer, right? You're the one that is opting into this, and where you choose to go and the questions that you choose to ask will dictate what other centers and programs look like, right? Because if we as patients say, this is what I'm looking for, and I'm not going to stop until I find what I think is best for me, all of the business, right? I'm saying this in quotes, is going to go to that place. And that is a way to kind of organically change the system as a whole, right? Because if all of a sudden the patients are shifting their care to this center, this program, this surgeon, others are going to follow suit. They're going to go, well, why are patients not coming to me? Well, what's going on at that program that is allowing it to thrive, especially in the landscape that we find ourselves in today, right? GLP-1 medications and compounding pharmacies have absolutely disrupted kind of the trajectory of obesity care. So for patients to be not only armed with this information, but utilizing it is a way that we can kind of say, look, yeah, this is important, but for patients, our quality of life, this is what matters. And this is where we're going to go to achieve that.
Mm-hmm. Yeah. It's a key thing finding that. And I think within our profession, our societies and stuff too, maybe pushing more of looking at that, and looking at those other outcomes beyond just the surgical. Even in our guidelines, they're very much more focused on those numbers wise outcomes, and it's kind of the way the guidelines are written. And calling out my surgeons a little bit here, get us more involved, the IH team, because we're that important. The major society guidelines, there's zero, maybe one, maybe two IH people on them, and then a huge block of surgeons, and so very little IH voice in putting those together. So we really need to get us more involved, because then we're making sure that we're really encompassing more of what the patients are looking at post-surgery as well.
Mm-hmm.
That's my opinion.
The visual that comes to my head, it's like, look at all the car manufacturers, right? Look at the supercar manufacturers, right? Ferrari, Lamborghini, Bentley, Rolls-Royce, right? They spend a lot of time focusing on the look of the car and the power of the car and all this kind of stuff. But if the person driving it doesn't feel comfortable in that car, have you really made a supercar? Mm-hmm. Right? You've made a technically sound vehicle, but you haven't actually made a car that people feel comfortable driving in. Yeah. And I feel like this integrated health discussion is about bringing the best of the best together, right? And it's like, what is going to make this the best technical experience, but also the most enjoyable and meaningful to the people who we're producing it for?
Absolutely. I love it.
Yeah. Okay. At the end of the day, a Hyundai is great, but it's not a Ferrari.
Right? And a Ferrari, not my... Right? Just say it. Well, and again, it goes back to what we always talk about. You have to take these centers for a test drive, right? You just do, because you think that this center is going to be perfect for you. But when you actually sit in it and when you drive it, it's either going to feel good or it's not going to feel good. I remember when Grady was living in Arizona, we went to the mall the day that it was a fabulous day. There was a Lucid dealership in the mall, and Lucid is a brand of electric car, right? And they look beautiful. I mean, we love the look of it, and we weren't shopping for a new car, but it was there, and we never sat in it, right? So we're like, oh, cool. Like, oh, well, let's sit in it. Let's see what this is all about. Well, he and I I was in the passenger seat and he was in the front seat, and it was like, wow, this interior is amazing. But then we just kind of you just kind of settle like it's your car. And we're like, oh, your head's hitting the top. And it was like, oh, I have a hard time seeing back here. Right. And all of a sudden you're like, okay, well, it looks cool and the interior is awesome, but this is not a car for us. This car was not built for us. And it's not that it's not beautiful looking and does all the things. It was not correct. And
just like clothing, just like cars, right? When you're making a big life decision that is bariatric surgery, it really is important that you find that best fit. And it goes back to what we said earlier. Your insurance or what you're able to do might only have one option.
Mm-hmm.
And if that's the case, fine. How can you make that one option the best fit for you, despite it missing some of those pieces, right? And that's where you as the patient sometimes have to go outside your comfort zone and go, I really need something else. What out there can help me round out this team?
Yeah.
Heidi, for the practitioners listening to this, I'm going to guess they might have questions about how you sustain this integrated team that you're working with. Are there like tips or tricks? Are there ideas that you can pass along to your peers that will help them maybe transition to that more integrated system that you're talking about?
Yeah, I think a big one is respecting and valuing all of the different voices on the team. That not making anyone more important than the other. When I was at the annual meeting in DC and I listened to a surgeon talking, and it was talking about, just concerns like people struggling before surgery and do we go forward? And that surgeon said, if my front desk person says they're kind of concerned about this patient and moving forward at this time, they mentioned this or that, she says, I listen to that. And then we have a conversation about that. And I think that's a big thing, because on some teams are more hierarchical and the psychologist is for clearance and, those types of things, and the dietitian for doing those appointments that are required by insurance. And, whereas the teams, that I think that's a big thing people need to do is really learn to listen and respect to all voices, give them all equal weight as they're discussing patients and helping them.
Yeah. And I would imagine that's hard to do in a system that was kind of built from the top down.
Yeah.
Right. So you're moving from this triangle, if you will, to more of a circular system. And that can be challenging sometimes.
Absolutely. Yeah.
But knowing that patients are looking for this might give a little buy-in from everybody else, right? Especially in today's world. It's like, look, patients are looking for this. And if we're not delivering it, we might see fewer patients than we currently are.
Mm-hmm.
Okay.
Yeah.
Okay.
Well, and a lot of it comes from kind of we talk about the stigma of, patients in needing the surgery in the first place, but there's also a lot of stigma placed on the healthcare team because for all the years we've grown up, the doctors, the doctor knows, the doctors, it's the white coat syndrome, it's the things. And we don't give them the same amount of kind of space and grace to move into a better, a better existence. We can't expect the same for us. And it's kind of a cohesion situation where we have to let those changes be made. We have to do a little bit of research ahead of time and do those things so that we go in with a little bit of a different mindset, because it's not always it's not that way anymore. Like we used to think it was just one way and that was the only way it could be. And the same way that we think that people, are looking at us with, just eat less, move more, and you won't need surgery at all. That's old mindset. The same way as, oh, well, I can't ask the doctor anything, or I can't be too loud, or I can't ask too many questions. I don't want to be seen as a problem that, maybe they won't take my case. It's not that way anymore. Like April said, you have to shop it around, because at the end of the day, as crazy as it sounds, they work for you. Like what they're doing, the service provided by you, if you choose to go there. It's not it's not an attorney situation where they have to take your case or like that. It's one of those things where, you can say, I want to have surgery here, or I do not want to have surgery here. And another thing that I've really been kind of thinking about lately is that we Irish goodbye those that we don't want to have surgery with, instead of following up and being like, hey, I really was interested in having my procedure here, but let me explain to you why. And they may care and they may not. They may not want to hear it, but at the same time, it also may lead to the change that for the next person, it may be a little bit better. Like April was saying, eventually, if they look around and go, well, why is everybody over there having surgery? Maybe if one or two of the patients would have been like, I was going to come here, but this is what I found. And just explain to you, and not in such a way like, oh, your surgery center sucks, that's why I'm not going. But you could be like, well, when I spoke to such and such a person, this is the feeling I got. Or when I asked these questions, this is what didn't happen for me. Or when I looked into what a fully integrated health team looked like, you guys just didn't match that. And that may make them think about things and make a few changes in the fact that so the next person that comes along may have a better experience.
Mm-hmm.
Oh, I love that. Yeah.
I was going to say, who is this other person on this podcast? Where have you been body snatched, Jason? Like what? I mean, I think we're witnessing.
I got to come in and just sneak in with the little gyms every now and then.
Heidi, just so you know, he does this every single time to me. And I think he like relishes in it because I think he's going to say something and he comes and drops these bombs. And I'm like, who are you? Like what? Who? I mean, again, I'm just going to say this is the power of these conversations. It is the power of community. It is what we have really gone through in BariNation is exactly what we hope every people do, right? You go in with a certain understanding and a set mindset and you think it's going to be a certain way. And when you stay open to listening and learning and having these conversations, your mindset around everything really does change. It takes a lot of time and it takes a lot of work. But the payoff for that is a much more truthful and holistic understanding of what it takes to treat this disease. And you have the skill set and the confidence to ask the questions, to offer the feedback, and to be grounded in your decision. And that is yet another tool that we as patients and providers can use to take power away from this pervasive disease.
100%. That's very powerful.
Right? Yeah. Like good job, all of us, because this is hard. It's relentless. The disease never stops. There is no cure. And there are moments in your life where the disease takes a back seat and you almost forget that it's there, but it's not going to be that way forever. It is going to rear its ugly head again and again and again. Mm-hmm. And the important role that an integrated care team can have on your bariatric journey has not really been talked about. And we're so thankful that there are experts like you, Heidi, who are willing to come on the show and talk about it and educate us on this. Because when we come together as patients and providers, this change happens and people are able to access the care that they need. They're able to continue to fight the disease and they have put the right team in place to make it all possible.
Yep. And well, kind of thinking, just throwing this out quick too, longitudinally, when, it's progressive. So if people are struggling, think about that patient that has stayed connected with their team all along. They're going to feel comfortable going in and asking for help. Whereas if they're not well supported, unless they call for help, they're going to be less willing to call for help. One of the studies I read talked about patients describing this post-surgical cliff where they had all the support up front and then afterwards it just dropped off. Ooh. And I'm like, ooh, that's a good term. And so you feel, you're more likely to feel like I can't go in. I'm ashamed because I've lost weight. Rather, if you're with that supportive team the whole way, you can go in, you're not afraid to call when you're struggling.
Yep. And as Jason and I can both attest to, there have been plenty of times along this journey where we were scared to ask for help. We didn't know where to go. Mm-hmm. And what has helped us be not so scared is having these conversations in community, right? Having these conversations on the show, but really having the conversations in BariNation. It's where we've been able to kind of work on that confidence muscle and say, yeah, you know what? You're right. I should ask that question. And to have the space to practice asking that question is also needed. And after you have done that scary thing, to have this, again, safe place to come back to and say, guys, I did it. I asked this question. Here's what happened. It's just, we all need a place to be a little bit vulnerable and to practice living this life as a patient. Mm-hmm. It's really hard to do on your own, but when you have the right team around you, when you have that community around you, it doesn't have to be as hard. All right, my friends, we have talked about a lot during this show. I want to let you all know that in the show notes, you are going to find links to the research that Heidi has referenced, because we know that you are going to want to take a deep dive on this. We're also going to put together a worksheet or a one-pager, if you will, that you can print out to help you identify the type of team that you're currently working with, or find one that you would want to work with. So we're going to have all of that linked in the show notes. There's also a link to the BariNation community if you're interested in learning more. But we want to make sure that you're leaving this episode with some tangible things that you can use to help you build out your team. And all of that is going to be linked right down there in the show notes. So don't be afraid to access them. We always like to ask this question at the end of the show. And Jason, I'll start with you first. But what is a big thing that you're hoping people are taking away from this conversation?
Is to ask the questions, do the research. There is no such thing as a dumb question, and there's no such thing as too much research.
Truth. Heidi, what about you?
What he said, and and know that as a patient that you have the power and the right to find that team that best supports you, and you don't have to just settle.
Nope, we don't have to settle. The disease has kept us isolated for far too long, and when you make the decision to treat it differently, a whole world opens up to you. And there's some decisions to make, there's some questions to ask, but we really are here to help guide you every step of the way. Heidi, thank you so much for your time today. This conversation was amazing. And we are so thankful that you stepped out a little bit of your comfort zone and joined us here.
Thank you. It was wonderful.
Awesome, friends. If this episode was impactful for you, share it with somebody else. Send them the link, direct them to YouTube, but make sure that this conversation goes beyond you. Thank you all for joining us today, and we'll see you in the nation soon. Bye, friends.
Bye.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.